All right, hello everyone. My name is Tracy Woodruff and I'm the director of our Environmental Research and Translation for Health Earth Center, which is funded by the National Institute for Environmental Health Sciences. And welcome to our special Earth webinar on the realization of an investment in a new tool that will help support researchers in investigating the role of public policies and perpetuating systemic racism. So before we get started, I'm going to talk about the goal of the Earth Center, and I'm going to introduce our first speaker and talk about why we're so excited about this new tool that we'll be offering at UCSF. So the goal of the Earth Center is to support research at UCSF and beyond on environmental contributors to disease and disease inequities and how we address those influences. As such, we at the Earth Center support strategic upgrades to our tools to support research to investigate environmental contributors to disease and disease inequities. And as people are familiar with on this call, there has been a renewed focus on systemic racism and its role in health and environmental inequities. And just want to give a little personal note that I've been working in this area for most of my career, all of my research career. I really became very personally interested in this through some work I was involved in addressing the role of redlining in creating exclusive communities, including the city I live in of Piedmont. And so through that experience, it became very clear that redlining would be a really important contributor to understanding and adding to our existing data and structures at UCSF so that we could help identify causes and interventions to address these policies that have excluded Black, Brown, and Indigenous communities, and also put them in the same location as polluting industries. So I'm really super pleased that we have Dr. Peggy Reynolds and Dr. Debby Oh to talk about this new tool that we have launched. And I'm first going to introduce Peggy, who is one of our co-directors of our Integrated Health Sciences Facility Core, and along with Aaron D'Amico. And she is a professor in the UCSF Department of Epidemiology and Biostatistics. She's an environmental epidemiologist, and she studies risk factors for cancer, much of it focused on population research and breast cancer and environmental contributors, including air pollution, agricultural pesticides, and persistent organic pollutants. And she's engaged in a lot of projects focused on women's health, including chemical exposures in California's female workforce, drinking water contaminants, air pollutants, and mechanisms of cancer risk associated with sleep disruption. And we serve together as multiple PIs on a newly funded UCSF study to investigate environmental and social influences on cancer development. So I'm going to turn it over to you, Peggy.
Thank you. I'm going to attempt to screen share, and hopefully I get it right this time. Can you see my slides? Did I get this, Alana? Okay.
Looks great.
I just want to take a few minutes because our featured attraction really is my colleague, Debby Oh, who's done this wonderful work for us, and we're very excited about this edition. I wanted to say just a few words of background for the one or two of you that may not already be familiar with redlining. I can advance. So this started as part of the 1930s New Deal when the US government was issuing mortgages to encourage home ownership, but they had a number of parameters for appraising those properties and created color-coded maps to rank essentially the loan worthiness of neighborhoods. So this ended up happening, covering over 200 cities in the United States. Neighborhoods were ranked from least risky to most risky for loans, and the most risky were predominantly where Black residents lived. Here's sort of just a brief summary of the codes that were developed. Ranked from by first grade to fourth grade. And by color, the green areas were designed as very promising areas for making loans, not fully built up. Blue areas, as a rule, were completely developed and attractive for loans. Yellow areas were, and I'm quoting from the actual documents, yellow areas are characterized by age, obsolescence, and infiltration of a lower grade population. And red areas were characterized by detrimental influences in a pronounced degree and undesirable population or infiltration of it. This was in existence for quite some time. Racial discrimination in housing, as many of you know, was outlawed in 1968 as part of the Fair Housing Act, but there are extraordinary lasting effects of this legacy. And so I just wanted to mention for those of you who are Fresh Air fans that there was an interesting interview by Terry Gross back in 2017 featuring the book by Richard Rothstein called The Color of Law. Rothstein did a detailed examination of the local, state, and federal housing policies that essentially mandated segregation and emphasized that the FHA furthered the segregation efforts by refusing to insure mortgages in and near African-American neighborhoods, a policy that became known as redlining. Rothstein says the housing programs begun under the New Deal were tantamount to a state-sponsored system of segregation. You'll see below this just is a YouTube link, which you can get after the presentation, to a very interesting example of how this influenced the East Bay and was referenced by Tracy in terms of some activities in her own community. So having little logistic problems here. So this is a map of the cities that were included in the HOLC mapping. As you can see, pretty much clustered in the upper northeast, but quite a number of places as well in California. I think one of the very nice examples of how these data may be very useful to us collectively and collaboratively is illustrated by some work from our colleagues at UC Berkeley that were featured in the New York Times a few months back, showing first an East Bay map of the redlining areas, neighborhood grade from the 1930s, described as best, still desirable, declining, and hazardous. You can see from 2010 how that overlays with nitrogen dioxide pollution and the percent people of color in these same areas in the East Bay here. So we have now the opportunity to be able to take some looks at redlining data in the UCSF Health Atlas. This is designed for all of us to present opportunities not only to visualize how these areas intersect with other characteristics of place, but to be able to also download these data at the block group level for data analysis for integration into existing and new studies. And so with that, I want to stop screen sharing so that my colleague Debby Oh can start to share her screen and say how delighted I am to be able to have worked with her on this. And thank you so much for the work you're doing. Debby is a colleague of mine in the Department of Epidemiology and Biostatistics. She's a data scientist with a background in epidemiology and graphic design. Her work involves analyzing and visualizing data from the cancer registry, electronic health records, census, and other public data sources. She led the development of several interactive visualization websites, including the UCSF Health Atlas, topic of today, and California Health Maps, and she's managed data dashboards for the Greater Bay Area Cancer Registry and the UCSF Helen Diller Comprehensive Cancer Center. So with that, I would like to turn it over to you, Debby. Thanks so much.
Thanks, Peggy. So are we on the right screen now? Let me just ask.
Yes, it looks perfect.
Okay, okay, great. So hello, everyone. I am so excited to be sharing with you today some of the work that we've been doing on historical redlining, and specifically how we integrated this historical redlining data into the UCSF Health Atlas. So I first, oops. Okay, great. So first, before we get into the redlining stuff, I just wanted to make sure we're all on the same page. I think most people in the audience are already familiar with the concept that when it comes to health, place matters. So, I mean, even if you're not a health researcher, you've lived through the COVID pandemic, and clearly certain populations are disproportionately affected. So where we live, including the physical and social environments that surround us, influences health both in positive and negative ways. So where we live is also influenced by political and often segregationist factors that Peggy has nicely outlined for us. So when we built the Health Atlas, we wanted to create something that researchers could use to better understand these factors that influence health at a population level. So what it is it's an interactive map of over 100 variables. Most of them are publicly available, and you can use this tool to explore these neighborhood level characteristics and see how they relate to health at a population level. So if you're a researcher, it can be used for like grant writing or study planning or hypothesis generation. It's not going to answer every question out there, but it can kind of spark some ideas and give you a sense of what's out there. Or if you are a policymaker or a community advocate or a public health professional, it's also a great tool to just kind of explore, what's going on in specific neighborhoods, or just as a tool to make a data-informed decision about your work. So we've been working on this for about 2.5 years, and we have more and more and more features. I'm going to walk you through them, or I'm going to walk you through the ones that I think would be most useful for you. But here's a list. So we have 4 different geographies. So census tract, which is essentially a geography that contains approximately 4,000 people. We have zip code. We have place, which is sort of a patchwork of zip codes and cities and regions. And this was created by the LA Times specifically to match the way COVID cases were reported. And then we have county level maps. Something new is that we have, in addition to Census 2020 geographies, in addition to Census 2010 geographies, we have Census 2020 geographies. That is very new, so not all of our variables have data for that. You can also compare 2 different variables. You can visualize data distributions. You can do a custom area selection. You can export the data and use it for your own analyses. There's detailed data descriptions. So if you want to know a data source, or if you need just a little bit of background for a grant or some references, it's all there. And we also have data stories. Okay, so I'm going to walk you through some of these things. So our 100 plus variables are loosely organized based on a social determinants of health framework. So we have demographics separately. That's not necessarily a social determinant of health, but we have socioeconomic, community, neighborhood, and healthcare data. We pulled out the COVID data separately just so it's easier to find, and plus there's just a lot of it. So the data was taken from over 20 different sources. Many of these sources are publicly available, if not all of them. The majority of the data, however, comes from American Community Survey, the Los Angeles Times, the California Department of Public Health, and CDC Places. Okay, so this is what it looks like. If you want to visualize one variable, you can kind of find it in the selection panel, and it'll show you that variable, what it looks like for all of California. So if you want to zoom into the city of interest, you can, but if you want to see all of California, all the data is there. In this example, we're looking at poverty among all individuals. If you want to look at 2 variables, this is what it looks like. So poverty is blue. If it's darker blue, it's a higher percentage of poverty. And asthma is yellow. So for a higher proportion of people with asthma, it's a darker yellow. And green is both. So it's like simple color theory. And one thing I should note is that the map displays 2 variables layered on top of each other. It's not filtered data. So here's that same view, but I just wanted to kind of highlight the data distributions. So if you look in the left-hand side, you can see there's 2 different histograms. So poverty has a blue histogram. You can see that the distribution for the entire state. asthma has a yellow histogram. You can again see the distribution for the state. All those values, those percentages in black, those are percentages for the state. And then there's a way that you can make the scatter plot a little bit bigger. And you can take a look, you could see the distribution. If you're interested in a particular outlier, you can click on that point and it will take you to the geography that it represents. So here's where it gets fun. So we have a feature on our site, which I think is pretty unique, where you can select a custom area. So there's a few ways you can do that. In this case, I took a few census tracts to look at the southeast part of San Francisco. So this is approximately Bayview Hunters Point. And so when you select that, you can save it, and then you can see kind of custom estimates. So all the numbers in orange are estimates for that area. And then you can also see where that area lies in the various distributions. So you can see in the histograms, there's like this orange bar, and that's where that area lies in the California distribution. If you look in the scatter plot, there's an orange dot, and that is where it lies in the California, and all the different census tracts in California. And the way that it is generated, there are weighted estimates to aggregate the data from the census tract level. So it's not perfect, but there are best estimates. Okay, so now what you came for. So the historical redlining. So Peggy showed you this map. This is a map of San Francisco. And again, you'll see the 4 different colors. The red is why we call it redlining. Those are the areas that were deemed hazardous. Green is on the other end of the spectrum, and those are considered the best areas. What is not colored is either sparsely settled or industrial or commercial. So where, back then, the city was different than it is now. So some of the areas do not have data, historical redlining data. Okay, so this is what it looks like in Health Atlas. Here we're looking specifically at San Francisco, Oakland, and what you can see is the same 4 colors in the map. So we have the red, the yellow, the blue, and the green. And this is at the census tract level. So we use data from the University of Michigan Institute for Social Research. So this is all publicly available data. We did not create this ourselves, but we integrated it into our tool, and which allows you to kind of explore in conjunction with other variables. Before I move on, I actually want to go backwards to show you what the map looked like again. And you'll notice that these are not 2010 census tracts. And so there's a little bit of fancy math that had to go into creating this map, which is based on 2010 census geographies. Okay, so if you want to learn a little bit more, there is this tiny little eye right here, and you can click on that and it'll pop up this panel. And the panel tells you things about how we report it, what is in the map, why it's important, our data source. If you scroll down, there's some references. So if you want to learn more, that's a great place to start. You also kind of see in the map, there's these pins. And that shows you where there is data, because again, not the entire state doesn't have data for this. There's only specific regions. And so those pins just kind of help you find where the data is. Okay, so let's see how we can use this. So this is historical redlining plus asthma data. So the historical redlining is in the 4 different colors, and then we added asthma in yellow. To me, what is interesting is actually the scatter plot, so you can kind of see that in the regions that are A, they have a lower proportion of people with asthma. And then if you go over to D, you can see that it's slightly higher. So that's just like one way that you can kind of get a sense. And again, it's not going to answer all the questions in the world, but it can lead you to maybe some interesting hypotheses that you can dig into further. So I wanted to quickly walk you through all the other variables in the map in case you want to know what other things you can look at in conjunction with with historical redlining. So we have our demographic data. We have a few different cuts of age and sex. We have fairly detailed race and ethnicity data. In the map, you'll see this is over 65 years old. I believe that's at the census tract level. For socioeconomic data, we have a few socioeconomic indices. Neighborhood socioeconomic status is an index that that our team has put together and put out there. There's also the social vulnerability index, which is available nationwide, I believe. We have the Healthy Places Index, which is specifically for California, and the California Department of Health use the Healthy Places Index for some of their COVID planning. There's also a few different measures of poverty. There's unemployment, digital access, educational attainment. For community data, you'll see things like population density, percent foreign born, percent limited English proficiency. In the map here, you'll see percent Spanish speakers at the county level. And then neighborhood data. So neighborhood data is where you'll find the historical redlining variable. So under housing, all the way at the end is historical redlining. But there's also other things, interesting things like overcrowding or severe rent burden. We have built environment variables, so things like street connectivity and environmental health variables like PM 2.5, estimated heat days. So you can go in and explore on your own. For health and healthcare data, we have kind of a long list of health outcomes: disability, arthritis, asthma. We also have healthcare access variables, healthcare use variables, things like cancer screening, preventive care, and then health behaviors, so things like binge drinking or current smoking. Lastly, there's COVID data. The COVID data are the only variables that have data over time. So for example, vaccination, we have data all the way back to December 2020. Case data we have from January 2020. We also have death and hospitalization data. Okay, so I'm gonna walk you through a few more features, which I think might help. We have a new feature called common areas. So I showed you before that there's one way that you can select a specific area. So my example was the southeast part of San Francisco. You can also draw a shape, or you can select common areas. So if you click on common areas, there's this short list. And if you are interested in a particular area for historical redlining, you can click on San Francisco, Oakland, Hayward. And it will select those, and then after you select it, then you will see the mark on the histogram, you will see it in the scatter plot, and you'll see the customized estimates. At the county level, we also have the Bay Area counties, we have various California census regions. For those of you who are part of the UCSF Cancer Center, we also have the 25 county catchment region. And for those of you who are tuning in from the Greater Bay Area Cancer Registry, you can click on GBACR counties and then get all of the counties that are included in that catchment as well. Okay, and that's historical redlining. Okay, so for those of you who want to dive a little deeper and do your own analysis, you can go to the top right corner, you click on export data, and it'll take you to this panel. So the letters are really small, but you can select the geography type. So here are census tracts, zip codes, counties, places. You can select what group of variables. So that's either demographic, socioeconomic, etc. Then the subgroup, and then you can select particular characteristics. So, if you want, you can just select them all, that's fine. But if you want to kind of narrow down what you're looking at, you can use this panel to kind of select, pick and choose what you want. One new feature we have is that this little checkbox only includes selected regions. You can, of course, do this in R or SAS, but if you just want to narrow down your data set before you get too far, that's one way you can do it. And then the last thing I wanted to mention is that we have historical redlining data as a categorical variable, like those 4 colors, but we also have it as a continuous variable just because it's available. It's not in the map because it's a little harder to understand in the map. But if you want the data, it's there. And it's actually from, it's from the University of Michigan. But we put it all there to make it easy to find. So another cool thing about the Health Atlas is we have Explore Maps. So it's in the top right as well, just under Export Data, there's a little blue tab. You click on Explore Maps, and there's a bunch of different data stories, including Introduction to Health Atlas, which I would encourage you to look at if you're just kind of starting out and want to get familiar with how to use the Health Atlas. We also have a number of data stories, so including food insecurity, housing insecurity, some COVID stories. And those are if you just want some insights into those without having to kind of like dig through the map. And so you can click on those and kind of walk through different types of data and what they mean. So at the very bottom is our newest story, which is historical redlining. And I'm going to show you what that looks like. So the redlining data story is fairly short, but I think it's helpful if perhaps you're new to redlining and are maybe also new to Health Atlas. You can click in and it shows you the story. The practice known as redlining has its roots in a neighborhood ranking system sponsored by the federal government in the 1930s. So that's what it looks like. Then you click next. Research shows a strong link between historic redlining and present-day environmental health disparities, including increased exposure to air pollution. And so this is looking at historical redlining and PM 2.5, which is a measure of air pollution. This is the study that Peggy mentioned that came out of Berkeley, I think earlier this year. And then the last step shows you where all the pins are. So explore historical redlining data in these California metropolitan areas. So we have San Francisco area, San Jose area, Sacramento area, etc. And then if you want to learn more, there's a few links there that you can click on and read some more. Okay, so before I start my demo and get too distracted, I just wanted to send out many thank yous. The Health Atlas has been a labor of love and a very collaborative effort. It was developed with support from the UCSF School of Medicine's Dean's Office of Population Health and Health Equity under the leadership of Dr. Kirsten Bibbins-Domingo and Dr. Courtney Lyles. We also got support from, obviously, the Earth Center to add the redlining data in, as well as to add those fancy features like the new data story. There's a few other groups at UCSF who has also given us input on those data stories. And we were fortunate enough to have the creative and technical genius of Stamen Design. And I think I saw some Stamen folks in the audience, as well as the writing expertise of Jennifer Pierce from Plain Language Health. Okay, so here's the URL in case anybody wants to demo on their own, but I'm going to stop share. And here's where we all start like sending good jujus that like my browser won't crash while we do this. But let's open my browser. Share screen. Okay, how does that look? Are we okay?
Looks great.
Looks good.
So this is what the Health Atlas looks like when you first land. Let's skip the tour for now because I will be giving you the tour. Our default, so what you see when you first get to Health Atlas is COVID cases at the county level. So, if that's what you're interested in, great. For today, that's not what we're interested in. I am going to walk you through what I just talked you through with my slides just to show you how to do it. So here's the different categories. So we first looked at poverty. So under a socioeconomic, under poverty, I believe it was poverty among all individuals. So that is it at the county level. If we're interested at the census tract level, we can switch geographies. Give it a second. My computer is overheating. I'm just going to keep talking you through. If we want to select a second characteristic, we go down to the yellow one, which also might take a second. And okay, so there's the map. And say we're interested again in asthma. So we go under health and healthcare, look at health outcomes, asthma. Again, give it a second. It should load faster normally, but whenever I do Zoom plus this, it takes a few seconds. And so here it is. So you can see the map and you can see the data distributions. But say you're interested in something else. You can refresh the page, just click on the little icon up here and you can have a blank slate. And let's start again. This time, I want to take you through a slightly different way because redlining is not as, you might not be able to figure out what category it is as easily. So, where's redlining? What you can do is you can type it in, redline, oh, and there it is. Okay, and then if you hover over, it says historical redlining, switch to census tracts to select. So that's what I'll do. Okay, and select, and there it is. Like I mentioned before, there's this little eye. You click on the eye, and then it has how Health Atlas reports historical redlining, why historical redlining is important, exporting historical redlining data, the data source, and some references. So anything, if you have any questions, that might be a good place to start first. If you want to add a second characteristic, let's do the same thing again, asthma, ASTHM, asthma. And there it is. If you want to select a specific area, you can kind of zoom in, say this time we want to look at, those two census tracts, or you can draw a shape. Let's do the sunset. Okay, so you can do that, or you can select common areas. And this again is that list. This list for the top 4 are at the county level. For the historical redlining is at the census tract level. Explore maps next. So if you want to explore maps, there's an Introduction to Health Atlas tour up here. And then all these data stories, and then the historical redlining data stories right here. You can see story on map. And another sort of hidden but possibly important feature is recent maps. So say you have been exploring, you've been trying a bunch of different variables, and then you're like, oh, no. What I really want is to go back to historical redlining asthma. You can just add that to the map. There's an FAQ, and there's a little bit of information about our team. And I'm going to try export data one more time. I'm not sure why that didn't work. Okay, here. Let's try this. All right, so I think I'll stop there and take any questions. I see, let's see, I don't know if anything has come through the chat. So Alana, I'm not sure how you wanted to do Q&A. Should we have people enter them into the chat, or should we do live questions? How did you want to run this?
Either works fine. So if anyone has a question, feel free to raise your hand and we can, we'll get you there, or definitely put in the chat. It looks like there's a couple questions in the chat right now. One very basic question: does the Atlas have access to child's health data or only adult?
Most of the outcomes are adult outcomes, but I want to say that we do have that child. It's not a health outcome; it's a child opportunity index, and then asthma. Yeah, I think asthma is only for over 18. Yeah.
And then we have a question, Bob.
Yeah, as usual, Debbie, great presentation. Thank you very much. I'm a great fan of the Health Atlas. I love all the things you're doing with it and adding to it. But I'm curious to dive a little deeper on redlining, and it's really a question that somebody on the call can probably answer, especially if they've read that book by Rothstein, which I haven't. But so redlining was something that started in the 30s, and it's a characteristic which you could call an exposure, but it was really describing something that existed. And so, you know, my mind sort of wants to go back further to maybe even 1865 in the beginning, or 1868, whatever it was, the beginning of Jim Crow laws after the Civil War. So the sort of sociologic and cultural process of segregation developed over a long period of time before there was redlining. So for those of you on the call that have actually tried to look at causation, how do you treat redlining, which is a cross-sectional phenomena that happened in 1930, and relate it to the previous 70 or 100 years of racial segregation? Small question.
I think that might actually be a question for Tracy or Peggy.
Hunt. Bob, that is like, so thank you so much for bringing that up. And I mean, when we were looking at the redlining data, it just came up that it's like, first of all, we wanted to, just the threshold question is, are we adequately incorporating data that will help us describe how systems can influence downstream health and environmental exposures? So the redlining has, you know, there's been a lot of, obviously our colleagues at Berkeley have published on this, and there's been other people talking about it. And I think it has, at least if you look at redlining, it has downstream consequences, as Debbie was saying, in terms of zoning, right? So that led to zoning, where you see right now in present day in California, we're dealing with difference between single family zoning. For example, in Piedmont, it's almost all single family zoning. And then that means that polluting industries have been moved into these, overlapping with these redlining areas. So, but your point about, could we be thinking is also even farther back about how did redlining come to be? Because it really is an extension of, for example, Jim Crow laws, or even before that, slavery. And so, I mean, those are all factors that we're really super interested in including. But, and I think as long as we're thinking forwardly too, is like, well, I think the redlining is very prescient right now because, for example, in California, all these communities have to look at how to address at least housing by adding new plans for putting new housing, including a certain amount of affordable housing within communities like Piedmont, Oakland, Berkeley, et cetera. So we can kind of think about, we have this historical construct that led us to this present day situation, and what are the policy tools to intervene? So, you know, that's how we came to this, thinking that this.
No, it makes perfect
But
sense.
I totally agree with you, adding more layers. I mean, the beauty of the Health Atlas is, you know, it has everything from environment to persistent poverty to health. So it's like an infrastructure that we can.
I guess the interesting thing that came to mind as I was thinking about redlining and listening is when you're thinking of causation, whether you think that redlining caused something, or whether it has led to policy decisions and things that are continuing to be problematic in terms of social justice. I mean, you could say that, you know, living in a racially segregated neighborhood or area might have caused something, either positive or negative, to thinking about the enclave studies. But the policy implications of the redlining laws in 1935 have had continuing impact. So I think it's another one of these situations where when you're doing epidemiology and thinking about causal inference, to be very clear about your, stating what your question is.
Right. And again, yes, totally agree. And our goal here is create the tool that allow people to look at this. And I think that's so great about the stories part too, is it gives you some context. Because I mean, I'll just be honest, my understanding of redlining was pretty vague until I saw Irene Chang, who's at the California Arts Community. She's an architect historian, give a talk about this and show how it was linked to how we live today. So I think, this is all, the idea is to generate more discussions about this so we can do something,
Right.
moving forward. So
Thank you for that.
so Alana, there's some more great questions in the chat.
Yeah, and it looks like a few
Oh,
have
green
been
space. That
answered,
is a
but
nice-
yeah, is Debbie, any plans to add green space data to the Health Atlas?
We don't have specific plans, but if you're interested in partnering with us, we would certainly be interested. I know that somebody on our team, and maybe Dan, you can speak to this. I know someone a data scientist on our team was doing some work in trying to get values for green space. Dan, do you know anything more?
We have done some work on green space in our other research and have some varieties of variables for it. I think, yeah, I don't know what level, if they would be prepared, if these variables would be ready to go into Health Atlas, but it's a good thing to think about, yeah.
Okay, so I would say if you have data that you think might be interesting to integrate, reach out, because we are open to collaboration. Okay, so let's go down for continuous. Okay, Mindy. So let me just say out loud. So there is the continuous variable and the categorical variable. So sorry, I'm trying to read Mindy's. But the continuous variable in my mind is kind of like the middle step that the University of Michigan needed to take in order to create the present day categorical variable. We thought that maybe it might be interesting to people doing research to have that. But we did look at it in the map and it was just harder to understand. Okay, space. Oh, Mindy already answered that too. And yeah, the green space data is not publicly available yet.
Debbie, I had a question. Could you talk about what % of the California population, I mean, the way you see the map and where the populations are is not quite in alignment. Can you talk about what % of the population is covered by the redlining maps approximately? Do you know?
I could find, okay, let's do again. Doing live
Sorry,
demo is always a
sorry,
heart attack, but this could be a really interesting use case.
I'm in California.
Let's try this. Okay. So in order to understand that, let's clear. Okay, so let's do common areas, or let's select a characteristic, and that is population. Give it a second to load. My computer is still protesting a little bit, but let's go to common areas. And so we'll want to go to census tracts, and we want to select them all, right? Okay, I should just let my computer do its thing before I break something.
Okay, well, while you're doing that, I'll just note that, right, you also added the persistent poverty. That was also part of the integration of this new data, right?
Right, there's also a persistent poverty variable in the map, and that is new as of 2022. Okay, so what I'm doing is I'm adding all the census tracts that have historical redlining data. Hope it doesn't break. Okay, so we did that. And what I want to find is community total population. There's your answer. 7.6 million versus a total population of California, 39 million. So,
Okay, thanks.
yep. Wasn't that great?
I know, look, we just showed it right there.
Yeah. Okay. Okay, thank you, Mindy, for dropping that in the chat. So the data is publicly available if you want to take it straight from them. You know, and probably there's more documentation there if you want as well. Anything else?
You answered the question about child health data, right?
Yeah, and you know, maybe this is something that we can also explore live. I want to say, okay, hold on, let me share again. Share screen. Okay, so let's clear child. Let's just put in that word. Nope. What would I put it under? Under 18. Well, we have households with children under 18. That's not it. I think another way we could do is just look at the list of health outcomes. So disability, I want to say that's total population. It's not child specific. Arthritis.
We have childhood poverty, the Childhood Opportunity Index.
Mm-hmm. Low birth weight infants.
Low birth weight, right? And teen
Teen
birth.
So just a few. And then asthma ED emissions. I don't know if this is adult only for asthma. So this is all asthma ED emissions. It doesn't specify if it is for adults. So I would assume that it also includes children.
Debbie, I have to say personally, thank you so much for the work of you and your group. It's been quite a delight to be able to bring our programs together for this, as Tracy so articulately said at the very beginning of this webinar. So thank you again.
Yes, thank you.
For the
That was really
opportunity.
great. It's
Yeah.
like, so every time we see it, there's like, it's such a treasure trove of data. It's like really amazing that UCSF, you know, it's great that they put this investment into this resource that you can see can be living as we come up with more ideas about what would be useful to cover so that we can better understand it or better address determinants of health and health equity.
So thank you for this opportunity to do this project, but also to share with all of you. Feel free to reach out if you guys have brilliant ideas. Email me, Deborah, debora.oh@ucsf.edu, and let's talk.
That's excellent. All right. I'll turn it over to you, Alana.
Yeah, that's perfect. Well, thank you everyone for joining us. I'll send an email to our Earth community mailing list when this is up in our YouTube channel. And if you are not a subscriber, just visit our website, earth.ucsf.edu, and sign up. Have a wonderful afternoon, everyone. Thank you.